Hello, I'm Dr. Chris Pelt here at the University of Utah Joint Replacement Center. By choosing us, you've chosen a place that's committed to quality, excellence, and value in your healthcare. Arthritis is when we lose the cartilage that lines the end of our bones. And instead of a smooth surface, now we have rough surfaces that are grinding on each other. So in a joint replacement, we're using smooth surfaces to cap the end of the bones and allow that joint to move more freely without grinding bone pain. Many patients will ask us what the surgical experience is like. Today in the clinic, as you get ready to be signed up for surgery, we're going to be going over a number of things, talking about the surgical process, filling out some paperwork. You're going to have a chance to meet with our surgical scheduler, look at the calendar, and choose a time or date for your surgery. Leading up to the days of the surgery, we're going to have multiple opportunities for you to ask questions. We're going to be providing you with some educational materials, and you're going to have the opportunity to attend our Joint Academy, where you're going to learn a lot from our physical therapists and other care team members about the experience as well. Our goal is to have you as well educated about what to expect about surgery before you get to the hospital. On the day of the surgery, you're going to be checking in at the front desk of the hospital. They're going to do the registration process there, and then they're going to send you to the same-day surgery area. Here you'll meet with nurses, anesthesiologists, as well as members of our surgical team, including our residents or fellows, our PAs, and the surgeons. You're going to have your surgical site marked. We're going to put our initials in the word yes, and that tells the members of our team that we know where we're operating and that everybody's on the same team. We're going to ensure that we have all of our paperwork on our side completed, including the surgical consent form that likely you signed in the clinic. Once everybody's ready, we're going to bring you back to the operating room. The time in the operating room is about an hour and a half to 2 hours for most surgeries. After the surgery, you're going to go back to the recovery room, and one of the members of the surgical team is going to come out and speak to one of the family members to let them know how the surgery went. The typical amount of time in the operating room, like I said, is about an hour and a half to 2 hours. The time for the setup and takedown at the operating room might be another hour, and then probably an hour or so of time in the recovery process. That means in total you'll likely be gone from your loved ones for about 4 hours. After that process, you're going to be going up to the orthopedic inpatient floor. After the anesthetic has worn off and you've been on the orthopedic inpatient recovery floor, you'll be greeted by our nurses, our healthcare assistants, as well as our physical therapists. Our goal is to have every patient that has surgery get out of bed and start walking the day of the surgery. You'll be able to put as much weight as you feel comfortable onto the extremity that you've had operated on. The therapists are going to help you get out of bed the first time and taking some steps towards the first steps in your road to recovery. Most patients will stay in the hospital for on average 1 or 2 nights. Ultimately, our goal, however, is to get people out of the hospital sooner than later, because the hospital is a place for sick people. There are other complications that can happen while staying in hospitals for prolonged periods of time. Infections from other patients, exposure to multiple people, and at some point we find that the best healing place is to get people out of the hospital and back home. That's an important topic to discuss. We find that the best results are when patients are able to return to their home. Our own research here at the University of Utah, as well as multiple other studies from nationwide databases, suggest that the highest complication rates are when patients attend skilled nursing facilities or rehab facilities after their knee replacements or hip replacements. As a result, we feel it's very important that we get people back to their own homes as a place to heal. You're surrounded by people that love you and care for you, and you're in your own environment where you're comfortable healing. Because of the importance of returning people back home, we also want to emphasize the importance of involving people around you. Whether it's family members, friends, neighbors, having someone involved in this process is very important. We'd like to have someone be able to accompany you to many of your visits, both preoperatively, during the surgery, and after the time of discharge. It's nice to have that person be able to be around you during your healing phase, at least in the first week or so. They don't have to be around 24 hours, 7 days a week, but if they can be around to help you do some of the light cleaning, housework, helping prepare some meals, that type of thing, you'll be able to walk on your own. This loved one or family member or friend won't have to be lifting you. You'll be able to get in and out of bed on your own. You'll be walking around, going to the bathroom, using the shower, making some light meals, going to the kitchen and refrigerator. All of these things you'll be able to do before you even leave the hospital. But having that person be able to relieve some of the burden of being at home is very important. So what is the healing process like after a joint replacement? Well, the first couple of weeks may be the most challenging. Many patients will have a lot of swelling, bruising, and soreness that relates to that. Some patients are requiring the use of some pain medications that we provide to you at the time of discharge from the hospital. The first 2 weeks is the time where it takes the skin to really heal. So we're going to see you back in clinic at the 2-week visit to make sure that the wound is healing well and there's no signs of infection or other complications. In those 2 weeks, it's going to be really important to take it easy, not overdo it. We see problems when patients try to push themselves too hard. Jumping on an exercise bike the day they get out of the hospital is probably not optimal, but rather gentle range of motion initially. In knee replacement, we want lots of elevation, getting the toes up above the head or above the heart level so that blood's running out of the leg instead of into the leg. That will help decrease the pain, decrease the swelling, and improve the healing process. With hip replacements, it's a little harder to elevate the extremity, but the similar principles hold true to the hip replacement as well. We want to take it easy, let the range of motion come slowly, and begin more aggressive strengthening and other activities later. After that 2-week appointment, continued progressive healing is going on. Most patients are starting to get off of their pain medications in the 3 to 4 week range. We're trying to wean off of narcotics and begin using things more like anti-inflammatories and Tylenol, which is actually a great pain relieving medication. By the 6-week point, we want most people to be off of all narcotic pain medications. People will begin to get back to their work activities somewhere in the 2 to 6 week range. Some patients that work at desks or have light duty sedentary type work may be able to get back earlier, but you will be tired as your body puts a lot of energy into the healing process. The more activities you're doing up on your feet all day and heavy lifting and such will take a little bit longer. So at 6 weeks, we tell most patients they're around the 50 to 60% healing mark. They're able to do most of the things they need to do. At the end of the day, they may be a little bit sore and a little bit swollen. They may still need to elevate, ice, rest, and use some anti-inflammatories to help with some of that discomfort. But again, able to do most of the things they need to do by this time frame. At the 3-month time mark, we're seeing patients becoming even more healed, in fact getting closer to around an 80% healing process. At this time frame, many patients are beginning to get back into activities that they enjoy doing. People that like hiking are getting back into longer than just walking around the block, but doing more hikes. Maybe up in the foothills before they're doing hikes up in the mountains. Golfers may be back to the putting and chipping phase of their golf game before the 3-month time frame, but starting to ease into activities. Most importantly, we want patients to gradually ease into the activities that they want to resume. We don't want to go from not doing anything to trying to run a marathon the very next day. So incremental increases, maybe 10% in activity day over day or with each attempt at activity, will be the recommendation. At 3 months, nearly 80% of the healing being done, so we still have more healing even at that time frame. What we find is that the healing process, regardless of the type of surgery you have, is very similar for all patients and in multiple body sites. Ultimately, it takes the soft tissues to remodel, the swelling to decrease, the inflammation to decrease, and that entire process of healing in some patients may take up to a year. You'll know that there's still healing process because you may still have some warmth, maybe some mild redness. You'll notice that the scar over your surgical site may still have a purplish hue or a red coloration. That's because there's still blood flow as that scar is healing. That blood flow in the scar is also happening deeper into the body, in the muscles, the tendons, the ligaments, and the tissues that live around the joints. So that process is still going on at the same time. So we tell patients to expect an amount of time to allow full recovery over the course of a full year. Patients that do more heavy labor type of work, up on stairs, ladders, carrying heavy objects, may take a 6-week time frame, and some even a little bit longer, up to even 12 weeks we've had some patients take, in order to get back to their full strength. Most patients will average 4 to 6 weeks. It does depend on which side of the body we've operated on. If we're working on your right leg, it may take you a little bit longer. You may be able to get back a little bit sooner to driving if we worked on your left leg. You have to be off of all narcotic pain medications. Driving while under the influence of narcotic pain medications is illegal. So there's 2 criteria. You have to be off of pain medications and able to tolerate driving and able to slam on the brakes with your right foot, we find that the best recommendation is to allow our patients to practice in a parking lot before they get back to driving. The next topic I want to discuss are the risks of surgery. We don't just jump into surgery for all patients. We only do surgery when the possible benefits, the likelihood to get better, outweighs the possible risks or the complications that can occur with a surgery. Unlike other surgeries in other parts of our body, if we were to get an infection, it's frequent that a doctor may give you an antibiotic to simply make that infection go away. In joint replacement, we're using metal and plastic pieces. These pieces don't have immune systems that can help get rid of the infection if a bacterial organism lands on these parts. If that happens, that means that just giving you an IV or an oral antibiotic won't treat this. Likely, if we have an infection deep in the joint, we're talking about bigger things, likely more surgeries actually. The process is usually to take the parts that we put in out, put in temporary parts that have antibiotics in them. We also have to couple that with IV antibiotics that goes for about 6 to 8 weeks actually. 3 months later, assuming all of the signs of infection have gone, and we verify that with both labs and maybe even aspirating the joint, then we can talk about putting a new joint replacement back into that. But this is a big process. 80 to 85% successful, meaning there's still a chance that going through all of that doesn't get rid of the infection. The good news is the risk of a complication like an infection after joint replacement in healthy patients is less than 1%. It's very rare. It's more likely to happen with patient factors such as obesity, smoking, diabetes, a history of multiple prior surgeries in the joint, and predispositions to infections of other sites of the body or that joint that we're operating on. So if we can minimize these risk factors going into the surgery, we can significantly decrease our chances for a complication like an infection. There are other complications that can occur, blood clots being the next one I want to discuss. The risk of blood clots is also significantly lower than it's been over the previous years. The risk is probably also in that 1% range. We do give people medications to try to prevent blood clots. Historically, we gave people some powerful medications to prevent blood clots like warfarin, Lovenox, or other similar blood thinners. More recently, we've done research at the University of Utah as well as looked at national data to suggest that for well-suited patients, patients that have never had prior clots and have a low risk for clotting, may actually be able to be treated with just a simple baby aspirin in the morning and in the evening. So we've moved more and more to risk stratifying or identifying people at risk to have blood clots and using the appropriate medication to help decrease their chances of a complication like a blood clot. But again, it's rare. The blood clots that go to the lungs are the ones that can potentially be fatal, and we were trying to avoid that at all costs. There are other things besides just the medications we're going to do to help prevent those blood clots. During your hospital stay, you're going to have these mechanical squeezer pumps that we put either on your calves or on your feet. That's going to help keep the blood flowing after the surgery and prevent blood clots. In addition, just getting up and walking is a very good way to help prevent blood clots. Getting up, moving, keeping the blood circulating is going to help prevent that from happening. There are other potential risks, things like worsening of your chronic medical conditions, heart, lungs, kidney conditions can get worsened by a big surgery. You can have other things like a heart attack or a stroke. People can die from surgery. These are exceedingly rare complications. Your risk for these things happening are probably less than the risk of you getting in a car accident on your way to come visit us in clinic today. But it's important that you know that there are risks of surgery, what those risks are, and what they might mean to you. Again, I want to thank you for choosing us here at the University of Utah Joint Replacement Center. You'll receive excellent care. We're here for you. We want to hear from you. When you choose us, you're not just becoming another patient of ours, you're becoming a member of our family. There's going to be a lot of things that are still going to happen today at your appointment. We're going to go over a lot more information and sign some more paperwork. You're going to have ample opportunities to ask us questions, and I encourage you, if you have more questions about any of the stuff that we've discussed here in this video, to please let us know.